The following summary highlights the latest information from the 2025 American Heart Association Emergency Cardiovascular Care Guidelines as they relate to lay rescue CPR. Just like in previous updates, the goal of these guideline changes is simple: improve survival by improving early recognition, high-quality CPR, and early defibrillation. For out-of-hospital cardiac arrest, survival rates depend heavily on what happens in the first few minutes. The 2025 ECC updates continue to emphasize that early action by rescuers is what saves lives. Many of the changes you'll see focus on improving CPR quality, reducing delays, and removing the barriers that prevent people from stepping in to help. Let's begin with initiation of resuscitation for adults. The ECC continues to reinforce the importance of CPR with breaths in adult cardiac arrest. For trained rescuers who are able to provide ventilation safely, compressions and breaths should be delivered together. If a rescuer is not trained or does not have the ability to give breaths, hands-only CPR can be used, as providing compressions alone is at least far better than doing nothing at all. Whenever feasible and without delaying chest compressions, CPR should be performed where the person is found, as long as high-quality CPR can be delivered safely and effectively. It's preferred that the patient be in the supine position, meaning on their back, on a firm surface, since firm surfaces improve compression depth and effectiveness. Delays caused by unnecessary movement of the patient are associated with worse outcomes. So when possible, chest compression should be performed with the patient's torso positioned approximately at the level of the rescuer's knees, as this positioning has been shown to improve compression depth. Rescuers may also consider placing their dominant hand on the sternum when performing compressions, which may further improve overall CPR quality. The key takeaway is this: don't delay chest compressions. If high-quality CPR can be delivered safely where the patient is found, then begin it immediately. The 2025 guidelines also address an important barrier to public access to fibrillation, particularly for women. Evidence suggests that the need to expose the chest actually may be contributing to lower rates of AED use in females. Now, while proper pad placement is always preferred, current evidence shows that successful defibrillation can still occur even when pad placement is not perfect. Because of this, it's reasonable to apply the AED pads directly to the skin by adjusting the clothing or undergarments rather than removing them completely. The priority remains rapid pad placement and early defibrillation, while maintaining patient dignity and reducing hesitation that can delay the care. For conscious adults with severe foreign body airway obstruction, rescuers should perform repeated cycles of 5 back blows followed by 5 abdominal thrusts until the object is expelled or persons become unresponsive. This sequence reflects evidence suggesting that the back blows may be more effective and cause fewer injuries than abdominal thrusts alone. In special circumstances such as late-stage pregnancy or when abdominal thrusts are impractical, chest thrusts should be used instead. For adults and children in cardiac arrest following drowning, CPR with breaths should be started before AED application. Drowning-related cardiac arrest is typically hypoxic in nature, meaning oxygen deprivation is the primary issue. Early ventilations are critical, and applying an AED first may delay the initiation of effective CPR with breaths, especially since shockable rhythms are less common in these cases. A small change for foreign object embedded in the eye. We now only cover the affected eye. The change is to prevent increased anxiety from the patient not being able to see. When caring for a person showing signs of shock who remains alert, it's reasonable to place or maintain them in a supine position, again, meaning on their back. If the person is at risk for airway obstruction, such as decreased alertness or active vomiting, or if they cannot be continuously monitored, then it's reasonable to place them in a recovery position or on their side. In situations where there is no evidence of trauma or injury, such as simply fainting or dehydration, some studies show that raising the feet about 6 or 12 inches actually still may be beneficial. The 2025 ECC CPR guideline updates continue to reinforce a simple but powerful message: early recognition, early CPR, and early defibrillation. Those are the things that save lives. These updates are designed to improve CPR quality, reduce delays, and remove the barriers that prevent rescuers from acting. Whether that rescuer is a parent, a bystander, or a professional. Guidelines will continue to evolve as new science emerges, but the mission remains the same. Recognize the emergency, take action, and do the best you can. CPR doesn't need to be perfect to save a life, and doing something is always better than doing nothing. It's going to make you confident, it's going to make you informed, and that makes a measurable difference. Thank you for taking the time to review these important updates and for your continued commitment to life-saving care.